get as much time with our wonderful guest today as possible. Welcome, everybody. This is our last Early Head Start Summer Learning Series. And I don't know how many of you have done all of them or more than one, but I have to say that these have been pure joy to host. We have had some of the most amazing people coast to coast step up and volunteer their time to come share their expertise with us here. And the network that I created and just sort of happened upon folks to reach out to for this purpose has been really exciting. I didn't really look to go to the standby sort of early Head Start folks that we see at a lot of conferences. I tried to go outside of our typical wheelhouse, and I ended up connecting with some really incredible people. And Kimarie Bugg, I met because I saw her, I think it was your son. I don't even know. Was it your son? Okay, on a webinar, and it said it was, related to breastfeeding. And I said, oh, we need that topic. So I reached out to him. He connected me with Kimarie, who is really our expert here. And lo and behold, I normally don't read bios because it feels kind of stoic, but I want to read this to you because I want you to have an appreciation for the next hour and what you're about to have the wonderful opportunity to hear from Kimarie Bugg. She's the president and CEO of Reaching Our Sisters Everywhere, which is ROSE. It's a nonprofit developed to decrease breastfeeding disparities in the African American community. ROSE's mission is to train African American healthcare providers and community organizations to provide culturally appropriate encouragement and support so that African American mothers may begin to breastfeed at higher rates and sustain their breastfeeding experience to match the goals expected by the Surgeon General of the United States. Now, what I want you to really appreciate is that Kimarie has been a bedside breastfeeding counselor in large metropolitan hospital, managed perinatal and breastfeeding projects and programs at the state level. She has served as a technical advisor to Best Start, as well as for U.S. Baby Friendly Hospital Initiative. She was a founding member and officer of Georgia Breastfeeding Task Force, and she was trained at WellStart International. She's traveled throughout the country and outside of the country, training healthcare professionals to manage lactation. Kimarie previously worked at Emory University School of Medicine, Department of Pediatrics as a nurse practitioner. She's a member of the Best Fed Beginnings Baby Friendly Hospital Initiative. She also provides trainings for Georgia's WIC, breastfeeding, peer counselors, and a proud position held since 2005. She has 5 children of her own who are now adults. And I think I wanted you to know all of that because, well, maybe some of this is a little personal. I have 4 kids and I breastfed all 4 of them and was so happy to be encouraged to do that. And when I started reading and learning, and especially after she and I talked the first time about the disparities that exist, I was not aware of that. And I think it's important as early Head Start providers, people who are specifically reaching out to families who live in marginalized communities, that we're aware of something that can make such a big difference for a baby's start in life. So I am just super excited to turn the hour over to Kimarie, and she has got some incredible information to share with you. She's going to reserve about 10 minutes at the end for questions. So if you want to put your questions in the chat, I will keep an eye on chat for you. And certainly we will be able to share her information with you after the meeting as well. I want to thank everybody for joining us here on this July afternoon. And without further delay, I'm going to turn it over to you, Kimarie. If you need any tech support, just let me know.
All right, thank you so much. I'm going to share my screen so that I can get the majority of my anxiety out because, so let me stop. We practiced this and I didn't do it like we practiced. So I'm do it once more. I have a video in here and I want to make sure, okay, it is, that we can hear the video when it's time from the beginning.
You are with the friendliest audience ever, so it's all good.
So, and okay. Gonna try to figure out how I can also see the audience while I'm doing this.
You probably can't,
Oh,
because
okay.
it's gonna, and we can't either. Like, I can only see you once we do a big share screen like this. So it'll probably, if you want to
Okay.
take breaks from sharing the screen, you can always do that, and then you'll see the gallery view.
Okay, so what I'm going to do is I'm going to power through this so that I can then close it up so that I can look at you. I am very used to participatory presentations and looking in people's eyes, you know, especially even now that we can't touch each other. I do thank you so much for that introduction. My mentor mom, who was Audrey Naylor, who sort of started the American Academy of Breastfeeding, always used to say to me that anyone who needs a long introduction doesn't deserve it. And so I always try to keep it short as possible, but I do truly appreciate that. And I'm going to get started with this. And this was just a little bit about me. So you heard more than needed. So a couple of things that I would like for us to leave with is to be able to describe some breastfeeding challenges in communities of color. And we're going to discuss some reasons for the breastfeeding disparity gap. And then we're going to have a plan of action to address breastfeeding inequities in your environment. You know, I'm going to talk about some things that I'm very used to talking about. I'm going to leave enough time for us to ask any questions that you would like. This is something I've done for about 42 years now, pretty close to 43 years. And the reason I can pinpoint that exactly is because in 1978, I became an RN, a MRS, and a MAMA, all in that same year. And I won't say what order that was, but in that year also, I had moved away from Indiana, where my home and my family was, being around a lot of breastfeeding folks in my family. In fact, my grandmother is from Arkansas, and she was a lay midwife. She delivered about 300 babies, the granny midwives, they call them. And when I was 12, I traveled there from Indiana every spring break, and she'd allow me to help her. And my task, my duty was to take the baby, clean the baby up, and then give the baby to the mom to breastfeed. I absolutely fell head over heels in love with babies at that time. And that's why I decided to be a pediatric nurse. But when I had my children in 1978, I had absolutely no one to help me. Like I said, I had moved to Texas. So I was there with a husband, and I called La Leche League because I was told that they help people. So something you all may not be familiar with is that at that time, your phone number indicated exactly where you lived. And I lived on the side of the tracks where a lot of people who look like me lived. I never did get a call back. So I feel that I failed miserably at breastfeeding because I did not have any assistance. My mom came from Indiana for a couple of weeks. She helped. And then I just really struggled and did what I call token breastfeeding. So as a nurse, I decided when I was going back to the inpatient pediatric area at Scott and White Hospital in Temple, Texas, at that time, I did not want mothers to be as miserable as I was. So I started learning how to help other people breastfeed. I'd seen it forever, but did not know how difficult it was. And especially because I also had 2 babies. And so that's why I ended up doing what it is that I do. I became known as the breast nurse every place that I went. So our mission at Rose, Reaching Our Sisters Everywhere, is that Rose seeks to normalize breastfeeding by serving as a catalyst that provides resources, and networking opportunities for individuals and communities. And we're going to talk about language in a minute to sort of define what those communities mean, because it means a lot of different things to a lot of different people. And that's something that we've realized very recently that we need to kind of talk more about and decipher. So the good news, the absolutely excellent news, is for the very first time, the United States has reached the Surgeon General's goal of breastfeeding, which was 82%. The last breastfeeding report card from the Centers for Disease Control and Prevention stated that 84% of US women who have babies do breastfeed. It's been many, many years since that happened. When I started as the first bedside breastfeeding counselor at a large public hospital in downtown Atlanta in 1979, I guess it was, early 80s when I was in the nursery, about 22% of the women were initiating breastfeeding at that time. So we have gone from that 22%, and the guru at that time, the Surgeon General, was C. Everett Koop, who's someone that we got to know quite well because he actually started with the SBRANS grants at that time to support breastfeeding in different areas. And we met with them several times, had regional meetings at the airport in Atlanta to talk about what direction we wanted to go to increase breastfeeding. So it went from him and the Journal of Human Lactation that C. Everett Koop did to my most favorite Surgeon General, Dr. David Satcher, who was here at Morehouse School of Medicine for several years and got to be a mentor of ours also, who did the blueprint for breastfeeding, to Dr. Regina Benjamin, who was a student of Dr. Satcher's with the Surgeon General's call to action. And we'll mention all of those in a minute. But the concern is, again, that non-Hispanic Blacks, oh gosh, I don't know where I just got that little line. Breastfeeding rates are quite a bit lower. The gap has been pretty consistent for the last 30 years. So there are lots of reasons for that. And that has been for the last 10 years what Reaching Our Sisters Everywhere has been working on. But again, the glass is still definitely half full, because when we started this, even looking back to the 80s or the mid 90s, breastfeeding rates in the African American community was in the 40 and 50 percentile rate. So we are very happy with this, and we go on and claim that as a plus 3.5 to say that at least 76-77% of African American women do initiate breastfeeding. So this is one of my most favorite poets. And this is something I want you to sort of internalize as we have this conversation. It says, "Don't judge me." This is Tupac Shakur. "Don't judge me for the choices I make when you don't know the options I had to choose from." So again, the American dream is a little different for different communities. Women and, mothers and, all types of communities have different journeys to sort of get to that American dream. So this says, what's the matter? It's the same distance, but there are challenges and obstacles in the road for some of us. So this is one of my favorite little pictures. All the Disney princesses found their prince And so the next logical step is for them to have babies, hopefully, and provide first food. And first food is a term for breastfeeding, breast milk in indigenous and Asian American communities, which a lot of places also have adopted. As a W.K. Kellogg Foundation grantee, their breastfeeding portfolio is called First Foods. So, you know, and if you think about it, it definitely is the first food for humankind. This is Jahari's window. And I just want to prepare you and you know, to have this conversation definitely about disparities, is that we do understand that we pretty much know the things that we know. We know very little about the things that we don't know. And then we just don't know what we don't know. And until we are exposed to things and get information and resources about it, it's very difficult to know what you don't know. And so I just have to say that I have encountered, as a professional nurse for years and years and years, many healthcare providers, healthcare professionals who had never seen anyone breastfeed while they were growing up or even in their professional training. And I work very closely with nutritionists, with nurses, with physicians, and many of them in each one of those disciplines tell me that I've never known anybody that's breastfed. I've never seen anyone breastfeed. And so again, we need to be able to provide those resources and information with them also, but definitely also the mothers, the birthing people, the folks who we actually are our end users, those who we are supporting breastfeeding for. So this is a little slide that came from a good friend of ours, one of our partners from the Centers for Disease Control, Dr. Ruth Peterson, who helped us to understand that the way that we're looking at research also is a bit different, because what happens in most cases is they take all of the babies born in 1 year and talk about who initiated breastfeeding and who did not. And so she pointed out in this little presentation that she did, and I asked her, could I have a couple of her slides? And she generously allowed me to, is that it does look different for those who, if you just say, let's pull out the information about those who started breastfeeding. And so, and this is something she showed us very recently, you know, it takes a couple years to really curate and collect the information and the resources. So this is from like 2015, and I think they do have some 2017 now. But though for those who started breastfeeding, you can see that the gap is not that wide. And so this is something that we actually got from her in January of 2020. And so we're looking to have some other information and also to have some research that actually looks at this. And so I was really excited to see and learn that. So talking about health disparities, you know, we are all very, very familiar with those things. And so we just wanted to talk very briefly about breastfeeding's role in closing the gap. So one of the things that, or the way that we have structured the work that we do at Rose, and there's also a robe, which you'll hear about in a minute, which is reaching our brothers everywhere, is that we focus on peers who are our life's blood, partners, policies, and programs. So the first thing is for us to help our community, our marginalized community, to understand that breastfeeding is not just beneficial, that it truly is important, especially for closing and narrowing the gap on health disparities that the communities, marginalized communities, are disproportionately affected by. And these are just a few of those things: hospitalization for respiratory tract infections, 257% higher. And I just want to say that as a nurse practitioner working pediatrics, ear infections was the pediatrician's bread and butter. And it has been proven that children who are breastfed have much fewer problems with ear infections, otitis media. Premature babies and neck, there is a tremendous excess risk when these babies are not breastfed. Asthma, diabetes, sudden infant death syndrome, eczema, childhood obesity, maternal ovarian cancer, leukemias, and of course, maternal breast cancer also. So there is excess risk when these children are not breastfed. One of the other very important things that we help our community to see, again, because, knowledge is power, and is that breast milk affects every organ system of the body, every system. And there's not much else that you can say that about, Someone once said, well, water is like that too. And, it's a whole bunch of water in breast milk. But this is just absolutely wonderful. Some of the most concerns, barriers, challenges, problems that we hear from the African American community is that the mothers, birthing people are concerned from the day that they have a baby until the day that they wean that baby, even if they wean when the child is 4 years old, that they're not making enough milk. So we also have to discuss the problem with and implement the impact of supplementation on breastfeeding. The more you supplement and give the baby anything else, the less milk you make. So if a mom is exclusively breastfeeding, it sort of looks like this. This is a very, very cheap visual to help folks to understand. If you supplement a couple of times, then you're making less milk. It looks like this. So you supplement more, and you do definitely make less milk the more that you supplement. The other large concern in our community is that mothers get harassed, or they feel, when they're out in public breastfeeding. So there was a campaign that was here in the Atlanta area. Two master's students from Clark Atlanta did. Their little company was called Table for Two, where they paid college students to go into the bathrooms. They had them cleaned first and eat. They bought them pizzas and hamburgers and fish sandwiches and all those things. And then they took pictures and they said, would you want to eat your lunch in the bathroom? And, why do you think that a baby needs to eat in the bathroom? And that was a hugely positive and went over really well here in the metro area. And we've shared it all over. There are laws in every state that says that it is not illegal to breastfeed in public. And it's never been illegal, but the reason why that was done is because so many people were being harassed for nursing in public. So the other thing that comes to mothers, from mothers to us, is the fact that you say, go forth and do it. This is the best thing and everybody needs to do it, but nobody helps them understand how to. So women also need the skills of how to breastfeed. It's, not just the fabulous, wonderful, all those great things, and then, say, go forth and do it. We need to talk about positioning and latch. We need to talk about, if he have problems and soreness. We need to talk about how to get other family members to help with breastfeeding, and just the understanding that being a parent in general is overwhelming, and those types of things need to be shared with mothers. Not that, oh, this is just the most wonderful thing on earth, that you're going to be tired, you're going to be overwhelmed, you're going to be sleepy, but that's the joys of parenting. So with all that said, what we are working very hard to do is to change the narrative, change the way that we talk about first food. So instead of, children who are breastfed have fewer problems with ear infections. What we're saying a lot of times is that babies who are not breastfed have more problems with ear infections. So instead of, breastfed babies get fewer ear infections, lung and stomach infections, formula-fed babies get more ear infections, lung infections, stomach infections. And our community tends to appreciate that way of changing the conversation, changing the story, changing the narrative. So looking at the Surgeon General's call to action, as I mentioned, there was a Journal of Human Lactation that was put out by Sierra Coop's administration, Breastfeeding Blueprint that was put out by Dr. David Satcher's administration, and then the Surgeon General's call, and each one of the Surgeon General's call to action came out with Surgeon General Regina Benjamin, and each one of those documents built on the last document. So the blueprint looked at the concerns, the problems, the issues, what mothers say it is that they need, what healthcare professionals say that they need, and then the Surgeon General's call to action went much deeper on that and spelled out specifically the policies, the programs, how to work with partners, how to work with peers, and how each one of those entities can help to improve and change and move the breastfeeding landscape forward. So at our organization, we also did a breastfeeding blueprint, Saving Tomorrow Today, where we interviewed researchers and healthcare providers, physicians, nurses, occupational therapists, social workers. We had lots of mothers, lots of community certified lactation consultants, IBCLCs, to look at the breastfeeding landscape in color and help to guide us as to what the problems were at this point in time and which way we could sort of start to address that. So this was done 2019, and our biggest takeaway that we've been working on for the last year is the fact that even though that 77% of African American women initiate breastfeeding, every week about 20% stop breastfeeding because of barriers and problems that they run into. So 20% the first week, 20% more the second week. So again, by 6 months or so, or even by 3 months, very few are still breastfeeding. So we've been working very hard this last year on this particular problem, even though there are some other things that are highlighted in our breastfeeding blueprint. And we talked about a common language. This is not a good picture, it's pretty blurry. But one of the things that we kept finding out in the community is that a lot of organizations use the social determinants of health to sort of structure their research and even their grants and a lot of things that they do. And the social determinants of health, it considers the community. It says relationships between organizations. And so again, the mother to mothers and the end user had been left out of this for many years. And so that's why it's very important that when we are talking about the community, that we define those communities. For example, one of the things that I did for many years, I was trained specifically to train nurses to on lactation management. And we did practicums, week-long practicums all over the 8 southeastern states, and really traveled extensively doing this because, again, nurses were not trained formally to manage lactation. And then you're out in the workforce and in areas where mothers need assistance with breastfeeding, and we're not able to do that. So I call those nurses my tribe, my community. And so that is definitely a community. So we just need to be a little better at naming our common language and what it is that we're talking about when we say community. And so, for example, this is a community in Indianola, Mississippi. This is a place where we did our very first, what we call Rose Community Transformer training. So this is in the Mississippi Delta. And when we were setting up to do this particular community training, months before, we went to the local hospital, who was supposed to be working along with us, and said, can you give us the names or, connect us with, through our IRB, women who were breastfeeding, who left here breastfeeding. The hospital told us that absolutely no one of color left that hospital breastfeeding. Nobody. So we went out into the community. We went to the churches. We went to Dollar General and Walmart. We went to the recreation centers, and we found all of these beautiful women who were breastfeeding. You can see a couple of them got the babies on the breast right there. And this baby here was 2.5, almost 3, and it was delivered at that hospital, and as all of these babies, and they were breastfed. So in this training, and it was a 3-day training, when we really got to know them, about day 2, we asked, why is it that folks at the hospital did not know you were breastfeeding? And they told us that most of them did not breastfeed in the hospital. They said because nobody told them that they could. Everyone just bought them formula and told them to formula feed, and they thought that that's what they were expected to do. So we did write an article about this. And again, don't blame me for the choices I make when you don't know the options I had. So again, looking at the Surgeon General's call to action, these are some specific areas that they outlined that where we also definitely focused in on is mothers and their families, give mothers the support they need to breastfeed their babies, develop programs that educate fathers and grandmothers, strengthen the communities, and create a national campaign to promote breastfeeding. And I hope we have a little bit time to talk about that. During COVID-19, it was a very stressful time for anybody going into the hospital, especially for women who were having babies. More women had babies at home, of course, last year than for many, many years prior. But we were called on with some other organizations to write some policies about breastfeeding, because babies were just not initially, they weren't even being able to go to their moms. But then afterwards, they were not allowing them to breastfeed. So we did get it straightened out, but it took several months and several agonizing parents to go through this. Again, the uprisings, were something else that really took away and decreased moms breastfeeding. This was the white coats for Black Lives in Atlanta, Georgia, again at the hospital in downtown Atlanta, where 3 medical schools got together. And these are folks who hadn't been together in many years, Mercer University, Morehouse School of Medicine, and Emory University, and actually worked together for several projects and programs during this time. And this is a program in Australia that we've sort of adapted to. When folks it says that racism makes me sick. It damages my heart, my blood, increases my blood pressure, and it affects my unborn baby. So there were fires and floods that definitely also sort of impacted breastfeeding the last year and a half. This was a tornado in Nashville, Tennessee, which was exactly 2 blocks from Meharry Medical College, where my daughter was in school at this time, and she was out there helping clean up, and I was a nervous wreck. And the one before that was in San Francisco, again, where my son was. He's at UC Berkeley with his asthma, with all those fires and things. And he was still, both of them, my daughter and my son, who grew up around breastfeeding all their lives, were out talking with women and encouraging them to continue to breastfeed, that, you know, in the time of emergencies, we need to not wean. That's a really bad time to wean. Head to safety, keep offering the breast, learn how to hand express, because there was no electricity in those areas, delay weaning. There was a lot of milk sharing, and think positive. This is one of our little 2.5-year-olds that says, yeah, I'm still breastfeeding. You mad, bruh? So as I mentioned, peers are our life's blood. We absolutely love the peers. For years, years and years, healthcare providers have been encouraging and supporting breastfeeding. However, until the WIC peer counselors in about 2005, after they really got into the system, breastfeeding rates really started to skyrocket and stabilize as far as duration too. So we are really excited to work with breastfeeding women in the community to help other breastfeeding women in their communities. It's just absolutely nothing like it. We need all levels. We need peer-to-peer support, we need mother-to-mother support, we need the CLCs, we need the IBCLCs, and the breastfeeding medicine physicians. We're all in this together in order to make sure that breastfeeding rates continue to increase. Partners are vital. The fathers have told us for so many years that they're just totally have been ignored in the maternal child health space. And so we make sure that everything that we do include fathers. It's no, them and us. We do it all together. So all of our projects and programs, we always include the men also. Also, same-sex partners. This young lady has a wife, and the baby was 2 weeks old. She started pumping and inducing lactation when her, wife was about 3 months pregnant. And so by the time her wife was 8 months pregnant, 9 months pregnant, she was able to pump about 18 ounces of pumping several times a day. So their 2.5 is definitely exclusively breastfed, was breastfed by both moms. And this young man, his significant other had some problems and was not able to do skin to skin. So we do a lot of mock assessments at hospitals who are on the baby friendly pathway. So we convinced the staff to allow him to do skin to skin and take the baby to the transition area. And I mean, just the look on his face just did it for me for weeks. And he is absolutely amazing and bonded to this baby. And this baby is like 45 minutes old. And that's his mother who is with him taking the baby to the transition area. Now, it was a whole bunch of nurses back over here ready to pounce on him in case he looked like he was going to drop the baby. This is a quick little video I just wanted to show you.
Yo, 2 words, disgusting and formula.
Yo, don't look, bro. Plus, formula can't prevent diseases.
Neither can breast milk.
Breast milk prevents diabetes, cancer, and is like best for preemies.
Yo, Sheila's pregnant.
Breastfeeding is healthy, bro. It saves money and it helps them lose weight.
I was so ignorant. Yo, and it helps them lose weight too?
Yes. Real men encourage breastfeeding, bro.
Yo, thanks, man.
Learn more at breastfeedingrose.org.
So So that was just a cute little video that the guys did to encourage breastfeeding in the spaces where they are. And grandmothers. So this is 3 generations. And this is her mother and this is her mother. She wanted to breastfeed and they were giving her all the reasons why she should not. So she brought them to a community support, well, we call them breastfeeding clubs. Young Black women don't like support groups, so they will call them breastfeeding clubs. So she brought her mother and her grandmother, and they were all happy and convinced that breastfeeding definitely was the best thing for them. And they just kind of hear it from someone else because they thought that it was such a burden. And so it was just wonderful to see the transformation in mother and grandmother. Also, one of the things, policy, of course, definitely makes a difference. This is Dr. Aletha Maybank, who is the Chief Equity Officer for the American Medical Association, who is leading an anti-racism agenda for physicians, which is truly going to help to make sure that mothers, families, everybody gets equitable and respectful care. And equitable care is not getting equitable care is one of the main reasons why so many African-American women were not breastfeeding. Baby Friendly Hospital Initiative. We don't have a whole lot of time to talk about it, but it has been a major changes in breastfeeding rates for women of color. Because again, when it's policy, that sort of makes sure that everybody at least has access to the same things. And so it's policy that they do skin to skin. It's policy that the babies stay with the moms and they don't take them away. It's policy that all the staff are trained to help moms position and latch babies, and if they need to pump, to do that. So once that policy came into place and folks learned how to do that, then of course it's just beneficial for everyone. Some of the other very wonderful things we were excited about, this is the breastfeeding pods in the airport in Atlanta. Again, Atlanta was the very first hospital to get these, and these were, again, some young breastfeeding women who really stayed on the airport to get these done. And then here in Atlanta, they told them that they didn't just want the pods there, they want to make sure that there's information and resources on them also, because those are some things that we've continued to talk about. And then that they have a diversity of babies that they put on the pods. And so, of course, in each one of the tarmacs areas in the Atlanta area, you will see a wide variety of and culture of babies. And this was just one of the last pods, because we went around the country trying to make sure that all the little airports were getting them. And so this is the mayor of Jackson, Mississippi, when they were donating their nursing pod. Telehealth was so important this last, I've been saying more than since last February. And so we had the very wonderful opportunity to work with UNC Chapel Hill to provide resources to community-based organizations so that they could do telehealth. And so these were communities of color, Black, Indigenous, Asian American, that all got about 63 organizations we worked very closely with, who were able to do telehealth and give hotspots to families and tablets on the reservations so that they could continue to connect and they could help them. And we also bought Dopplers and blood pressure cuffs and all types of things that the birth workers needed. But we were extremely busy, extremely active during 2020 and continuing to be so like that. One of our most favorite things is Linda Smith, who is in Ohio, has taught an IBCLC prep course for many, many years. So she decided to give all of her materials to 14 IBCLCs of color. 2 were Hispanic, 1 was Native American, and the rest of the 14 were African American IBCLCs. And then we were charged with training IBCLCs of color. So to date, we've probably trained about 600 or so. About 400 of those have actually taken the exam and passed it. But this was one of our favorite classes because DC Breastfeeding Coalition did one of the classes in sign language. So these ladies are deaf. And so it is just amazing that they were able to do that work. So we talk a whole lot about representation to power. It's not good enough just to be in the room. It's important that we are able to have some power to make some changes. This was a day that I had happened to double book myself. Here in Atlanta, I had promised to go to Georgia State University to work with and talk to the public health students. I also do a breastfeeding medicine rotation with the pediatricians from Morehouse School of Medicine. So these 3 ladies here and these 2 here were pediatric residents. So I told them, well, we're gonna all meet downtown at Georgia State. That was one of the best presentations or just things that I have experienced because the public health students had a wonderful time talking to these pediatricians about health, and the pediatricians again had a very wonderful time hearing and understanding how these public health students saw the world. And of course, you know, the students were just absolutely amazing. So this was just an absolute wonderful day talking about breastfeeding, working through breastfeeding strategies, strategic planning with young pediatric residents and young public health students. One of the other things that we're most excited about is what we're calling a Consortium of Excellence, where we're working with the 4 Black HBCUs, medical schools, and Jackson State, which has a School of Public Health, and Xavier, which has one of pharmacy, to together do a young child breastfeeding and nutrition Consortium of Excellence. Partner sharing, just some of the partners that we work very closely with, the CDC, Health and Human Services, HRSA, Baby Friendly USA. Again, these are those ladies that we talked about in Indianola, several community-based organizations that are doing breastfeeding in the communities that are doing phenomenal jobs over the last 10 years. It's Only Natural, Mother's Love, Mother's Milk is an online platform that is absolutely phenomenal, that is housed on the Office of Women's Health website. It goes from planning ahead while you're pregnant to solutions and problems, all like 2-minute videos that are really amazing. So if you get some time, go and look at those, download those, because they really, and it's geared towards women of color. And this is the last little, let me see if that little video there will, try once more. And if it doesn't work, then we're just gonna do these questions right quick. Okay.
Is there a place where everyone, regardless of race, economic background, or gender, grows up with the opportunity for good health, a good education, and a good job? This place is not in our heads, but in our hands. It starts with a mother and a baby. Actually, it can start with all of us. It can start with you. When you support a woman's health long before she chooses to have a baby, and when she gets pregnant, you help her receive excellent prenatal care close to her home, where you explain why breastfeeding matters in a manner and language she understands. Before she gives birth, in a baby-friendly hospital you helped establish, where you help her breastfeed her baby right away, allowing her to bond with her baby, who breastfeeds well, and you're always there to help. When this mom and baby go home, you help them some more, and her friends and family do too. And she breastfeeds her baby for at least 6 months, and gets to stay home and care for her baby, and her partner gets time too, because they have paid family leave, thanks to your efforts that made it the law. And when she returns to work, her boss encourages her to take breaks, to pump in a clean space required by the law you helped pass. And there's childcare right there, where people understand why breastfeeding matters, because you led the way. On the weekends, her family shops at a local green market you helped set up, where they buy good food that is local, healthy, and affordable, that helps her child run, play, learn, and grow up in a safe community with clean air and good water. Until one day, many years from now, she gets her own job with good parental leave and has her own child and breastfeeds her. It takes every one of us to create a culture where breastfeeding is the norm and help a community become healthy right from the start. Beginning with one mother and one baby, we can help achieve health equity everywhere. Each and every one of us can make it possible.
One of my favorite quick little videos. And next. So in closing, again, this was back to Mississippi just a couple of years ago, where we have had tremendous success with breastfeeding rates. They are definitely nowhere near the bottom anymore. They have more baby-friendly hospitals because the insurance company said that everyone had to get on the path, and there are so many women now breastfeeding that we are just totally and completely excited about it. So we are having a breastfeeding summit July the 20th through the 22nd. So we would love to invite you all to participate. It's all virtual if you would like to. And that is it.
Wonderful. Thank you so much. That was so much information and all really phenomenal. I'm sure folks will be interested if you're able to share. Can I share the PowerPoint you shared with me? Because I think those links to those videos would be probably really appreciated in particular. Good resources for staff. I did not see specific questions come through. Does anybody have, you want the breastfeeding summit information? Okay, so I have someone asking for the summit information. And if you want to put in the chat, maybe the link to register or something like that, that would be good. And somebody's asking, how long is it recommended to breastfeed? What's the current recommendation?
The Academy of Pediatrics recommends 6 months exclusive and up to a year. The World Health Organization recommends 2 years and beyond.
Okay.
So it is definitely a mother's choice.
Is there any information linking breastfeeding to educational outcomes, academic ability?
There is. There was a study actually done in England in 1991, and I know that because I had children born in that year. Dr. Lucas and his research was on, they studied a cohort of children who were formula fed, and a cohort of children, 150 each, that received formula. They followed them, and they've been following them now for 30 years, but the first 10, 15 years, every couple of years, they would do IQs and lots of motor skills. So the children talked sooner. The majority of them walked sooner. Their IQs were 8 to 10 points higher than the formula-fed cohort. The research was replicated at several places all over the world, even at Tallahassee, Florida here also. Alan Lucas is the original researcher that started that.
Wonderful, wonderful. And then someone's asking.
Let me just quickly say, one of my favorite things is, did y'all know that breastfed babies have straighter teeth? The parents I work with love that, because the way you suck a bottle and the way you suckle at the breast is extremely different. And so your jaws and muscles develop differently. And the orthodontist used to tell my children, oh, so you were breastfed, when they went in to get their teeth cleaned, because their teeth were straight.
I did not know that.
Like the other children, they were upset they couldn't get those braces.
That is so interesting. How does a non-pregnant woman create breast milk? Someone asked that in the chat.
It's called induced lactation. So it just so happens that this particular woman did have a 13-year-old child, but there are others who can induce. It's all about stimulation. You know, there are women who come into the breast clinic. I worked in the breast clinic for several years too. And they'd come into the breast clinic because they had discharge, they had milk, and they hadn't had a baby. And so one of the first things I'd always ask is your significant other a breast man or woman? And they would say, how do you know? Do you know him? And it's because of the stimulation. So if breast is stimulated, milk.
Well, there you go. So that's good to know. And somebody else is asking is there any concern with breastfeeding past the age of 3 in terms of speech delays or language development or anything like that?
Absolutely not. That would not. There has been nothing tied to breastfeeding and the speech delays.
Okay. Very good. Those look like all of the questions, but I bet we could talk all day long about this. This is such a great, this information has been fantastic. I can think of no better way that our early Head Start folks can support their communities than to get babies started on the right foot this way. And it's so important. And I think what you said initially, you don't know what you don't know. If we're not opening the doors of opportunity, then folks aren't going to know. And it's just, we have to be the support for our parents. So we appreciate the resources. I will make sure that I share the PowerPoint back out with you all. And we are posting these recorded sessions online. I tried to find the link while I was here and I couldn't. So trying to do too many things at once, but I will get that out to you as well, because I'm sure that you will want to go back and maybe revisit some of this or use this as some of your professional development during pre-service, which I think would be fantastic. So
I wanted to mention one other thing too.
Yeah.
The University of North Carolina, CGBI, they have a program where they teach child care providers to manage lactation. And it's like a course where you actually get credit for it.
And where is that?
It's University of North Carolina, Chapel Hill, CGBI. I will get that information to you, but it's really great because you also get, credit for nursing credit, social work credit, health educator credits.
I'll make sure and get that out to you all as well. I think all of those things are super important. Fantastic. I imagine you're going to hear from some of these folks, Kimarie, and we'd love to have you back.
Some of those questions, but I know it's about the dentist though. Just let me say this really quick. The problem, it's usually formula that kind of stays in the mouth when children are sleeping that rots those teeth. That 2-year-old that the dentist is saying to stop breastfeeding because the breast milk is rotting their teeth, they're not sleeping overnight with breast milk in their mouth at 2 years old. And so I don't know where they're kind of getting that from. That's interesting. And we could get them some articles, whoever said that. If you need some, I can definitely get you some articles.
We'll send you back to educate your dentist. We think that's important. This is so great. You are wonderful. I will
Thank you so
imagine that
much.
we are going to want you back. And so I'll be in touch. I will keep everybody connected to Kimarie. Yes, big applause. We so
Thank you.
appreciate it.
Thank
This was
you.
so great. Have a beautiful afternoon. We'll be
Bye-bye.
in
Thank
touch.
you.
Take care, everybody.